mobile computers, email, internet access virtually everywhere, even on our phones. It's no doubt we are becoming more and more each day a wireless world. But we are still far from being a paperless society. In fact, despite advances in electronics, the average office worker still uses about 50 sheets of paper per day, and healthcare is by far one of the most paper-intensive fields today.
The healthcare industry is almost a dinosaur when it comes to the technology, not on the medical care side, but on the administrative side. Much of that pressure is brought to bear by the insurance companies, as well as the federal regulations. Due to some of the requirements that they have, they necessitate the use of a tremendous amount of documentation.
And all of that paperwork can lead to lost charges, lost data, and less time spent with every patient.
I think that the average practitioner is indeed spending a lot more time on paperwork and less time on patient care. And that paperwork leads to a lot of complications and a lot of increased expenses in medical practice with overhead expenses and additional need for employees, as well as inaccuracy and unreliability in paperwork handling.
However, an affordable turnkey solution has been developed for today's mobile physicians, placing patient information and billing data literally in the palm of the hand.
Electronic charge capture has had a huge impact on the industry. It's changed the way physicians look at the way that they collect information, allows them to be mobile but capture the information on a handheld and get it back into their central system. Saves them a tremendous amount of time and money.
Dr. Louis Lux, a physician in Austin, Texas, has been using this technology since 2004 and has seen significant improvements in the efficiency of his practice.
When I was submitting paper bills, I would spend generally 30 to 45 minutes a day putting those bills together. Now with using mobile technology, I'm able to get my billing time down to 5 to 10 minutes a day. I do it more reliably, more accurately than I've ever done before, and I'm able to track my bills.
2008 has been called the year of the boomer since the first wave of baby boomers reach retirement age this year. Over the next 10 years, seniors will be the fastest growing segment of the population. With more people seeking the care of physicians, streamlining office practices will become even more important.
I think that more advanced technology comes at the perfect time when the aging population is increasing and the complexity of medical issues and medical care in that aging population requires a lot of coordination. Electronic communication and electronic sharing of information is very important to efficiency and accuracy.
The use of electronic capture technology in the healthcare industry is going to benefit not only physicians and their patients, but the administrative side of the industry as well.
We do electronic charge capture, and rather than waiting for the paper documentation to arrive at our office, we retrieve that information electronically and the charge is billed out the same day. So the electronic charge capture process streamlines the billing process so that the revenue turns around faster for the provider office.
These simple-to-use handheld mobile devices also make collaborations and consultations between physicians easier.
One of the big advantages I find with this type of electronic bill submission is when I pick up another service of one of my partners, which we typically do since hospital operations are 24 hours a day, 7 days a week. We oftentimes will pick up our partner's service. And now I can add those patients quickly and with just one click to my patient list.
One of the challenges that practitioners face as they implement this technology is fear of change, and that's the fear of the change in their process. And how we address that as we move forward is our ability to provide a preference-driven application so that we can customize the application to the current workflow of the provider, which makes adopting the solution much easier.
How would you like a simple solution that eliminates lost charges, increases your cash flow, and lets you spend more time actually treating your patients instead of doing paperwork?
When considering the amount of time that a medium-sized healthcare practice spends pushing paper and capturing the necessary information, it's a significant amount of time every day.
Medi Mobile develops simple and surprisingly low-cost turnkey solutions that can increase the efficiency of your practice.
Medi Mobile provides a paperless mobile charge capture solution for healthcare providers. This mobile solution allows providers to quickly capture their billing and patient information, sending this information electronically to their billing office and further streamlining and improving their cash flow.
We also offer a green solution by eliminating all the paper that's involved in the mobile charge capture process, as well as a solution to further reduce paper through our eForm solution, which allows us to digitize basically any form that a provider uses while they're in the field.
Dr. Peggy Russell, president of the Austin Geriatrics Specialists, is a major advocate of this mobile system.
Before we had Medi Mobile, we used a paper billing system, which required multiple steps, multiple people handling paper, which was time-consuming, unreliable, and delayed payment. Currently, using the Medi Mobile system, we have marked improvement in the accuracy of our billing, in the timeliness of submitting our billing, and therefore in our cash flow.
Medi Mobile is also dedicated to furnishing healthcare providers with solutions that eliminate insurance and billing mistakes and provides better ways to manage patients' records, which is becoming increasingly important as providers become more mobile. And Medi Mobile's solutions integrate easily into existing systems, providing a seamless charge and information capture process.
There's a lot of competitors that want you to buy big pieces of equipment, whether it's servers or dedicated computers. With Medi Mobile, all I really need to do is have an internet access, which is nice. I don't have to spend a lot of my capital on equipment. It's the most reasonable product that I've used for electronic bill submission.
I recently worked with a small nephrology practice, had 6 physicians, and they had implemented a Medi Mobile solution. And the return on investment for them was less than 2 months. And each physician's pay increased by $30,000 per year based on that implementation.
The Medi Mobile solution is extremely important to the practice because it helps drive consistency in the billing process for the providers as well as for the billing office. It also helps bridge the gap between disparate medical systems, the hospital, their EMRs, their scheduling packages, their patient management packages. All of those have the ability to integrate with the Medi Mobile solution, and so we become the bridge that pulls all those systems together.
Put the future of patient management in the palm of your hand with innovative technologies from Medi Mobile. For more information, log on to medimobile.com.